Welcome to my YouTube channel or my Facebook page since we are live streaming on both platforms. I'm Dr. Tony Hampton, board certified family medicine and obesity medicine doctor, here doing a Protecting Your Nest post podcast episode where we're going to introduce you to my guest who was on my podcast. We just filmed it, or should I say recorded it, and that's Rashard Johnson. And I want to introduce you to him in a second. And what we talked about during that podcast was social determinants of health. And so you may ask, what the heck is that? Let's provide an example. I just want you to think about this example, a real life example of what that is. So imagine you have a single mom. She has congestive heart failure. In other words, the condition where her ankles are swelling and it's not well controlled. She works a lot of hours. She's trying to pay her bills, take care of her 3 kids. And because her resources are limited, she's not able to get her medicine. So over time, her ankles get more swollen. She gets a little short of breath and ends up in the hospital. But she's not in the hospital because she's non-compliant. It's not her choice. It's because she can't afford her medicines. Her inability to pay for those medicines is what we call social determinants of health. So any condition that is related to where people live, play, learn, work, whatever, that can affect their health are things like social determinants of health. And an example would be, what if you have bad housing situation? You can't pay for your housing. What about if your income is really low and you can't really pay your bills? How about if your neighborhoods are unsafe? Those are factors. Or you just don't have the type of education you deserve. So these are factors that are part of social determinants of health. And considering we're in a fight right now for inequities as a nation, we really want to understand what social determinants of health are and how they affect individuals and our country as a whole. So what I want to do is bring Rashard to our conversation and help him to, be part of this discussion. But before I do that, let me say a couple of more things about who he is. I want you to know who Rashard Johnson is. He's not just someone I work with AdvocateAurora. He's also a friend, and I consider him a colleague. But he is the president of AdvocateAurora Trinity Hospital on the south side of Chicago, as well as the president of South Suburban Hospital in Hazel Crest, Illinois. And that's in the 10th largest not-for-profit health system in the country. So a big accomplishment, and that's why I wanted you guys to meet him. Before he came to Chicago, though, he was vice president of operations and a chief operating officer for Chi St. Luke's Health, the Woodlands, Lakeside, and Springwoods Village Hospital. So he's actually a busy guy. He's accustomed to leading multiple hospitals at the same time. And he got his master's from University of Central Florida in health administration. And he's married, got 4 kids, and he's just an awesome guy. And I just want to make sure you guys hear him, because he's going to help us think about what can we do as a health system to think about these social determinants of health. And during the podcast, when we talked, he kind of told us a little bit about how he was a student and became a president of 2 hospitals here with AdvocateAurora. He told me a little bit about what he thought about social determinants of health, shared some great personal stories that I think you guys are going to be happy to hear when you listen to the podcast. And he also talked about how organizations like AdvocateAurora can do their part to make things better. He talked about the challenges we faced, and we touched on many other issues. So make sure you guys tune into that. In order for us to have a good conversation, however, I think we're going to have to bring our guests into the picture. So let's go ahead and bring our guests here to the picture. So welcome, Rashard. How are you, my friend?
Thank you for having me, Dr. Hampton. I'm doing just fine. Doing just fine. How are you?
You're supposed to be at home with your family. What you doing talking to me?
Hey, well, this is about a friendship and a colleague and a partnership. But I think the mission and the passion behind what we're discussing today, it brings us all here. And besides, my wife told me I can do it, by the way.
Oh, yeah. Yeah. Well, absolutely. So, I'll probably share my slides in a minute. We had a few slides, but while I'm getting ready to share the slides, I know during the podcast you had a chance to kind of explain how you went from being a student in your master's program to being a healthcare leader, leading 2 hospitals. So while I'm getting that done, why don't you go ahead and talk to the audience about how you became the president of 2 hospitals at a young age, actually.
Yeah. It's divine intervention. I always tell people that because I get that question a lot. A lot of people ask me that question, and I literally had no idea that this career existed growing up as an inner city kid. A lot of what we talked about is social determinants of health. I'm a product of that environment in a single parent household. But my mother was an educator, and I had an opportunity to go off to school and go to college at University of Central Florida, and got hurt and couldn't pursue my NFL dream. But I was guided to this profession, always guided towards healthcare, being a sports guy. But my professor took me on a field trip and exposed me to a hospital CEO. And my mind was blown at that point because I had never seen anything remotely like that. Didn't even know you can do business within hospitals and that infrastructure existed. So thank God for that guidance. And then I've stood on many shoulders and continue to stand on many shoulders, and many people provide support. But that's primarily the reason why I'm so adamant about reaching out to the youth and exposing them on what you can do with your various careers outside of just the norm of what you see within your environment. I think it's critical to expose kids to that, because that's helped me create a career and a lifestyle for my family. So grateful for.
And that's incredible. And I think you're right. We're all role models, whether we see that or not. And I think that for me, it gives me hope when I see people of color who are doctors, lawyers, obviously presidents, vice presidents, and things like that, because it really just gives you the potential in your brain that this is something that I can do. So, we really appreciate that you care enough about that as well, because I think that if you think about social determinants of health, some of the things that impact that are education. So, if
Correct.
I see somebody like me that can be in a role like that, then maybe that's hope for me. And I think you mentioned that part of what inspired you was some mentoring yourself. So, share that story.
Yeah, I had an opportunity to have great mentors and continue to have great mentors. I will tell you, in Miami was the first time that again I didn't see guys who were executives in our neighborhood. Most of the men in our neighborhood weren't a part of the families. It was a lot of single parent household that's there, and the successful men were either athletes or you know in entertainment business and rapping, and quite frankly involved in the wrong things in the streets. And so that's the only success you saw. And so thank God for a mother who was strong and educated and drove me towards education. But I saw my first African American executive. I was 22 years old at the time,
Wow.
and I was dumbfounded by that. And that's something that drives me today. And I tell people that all the time. I'm driven to get out and shake hands and let people know the possibilities that are out there, because I was that kid that didn't understand. But from that time forward, I found a way, and I won't get into the specifics of how I got to him, but I was able to get to him and become a fellow, a train up under his wing. And he's guided me for the last 15 years of my career, and really have been that platform and just that key staple of helping me learn the intricate details of healthcare operations and balancing safety and quality, and doing so with your capital budgets, and just taking care of people on a broad spectrum. So I'm excited about that, and I'm excited to now have a fellow myself. So I know you said I'm young, but I'm crossing that other side of the threshold. And I was like, well, how did I get here?
Right. Yeah.
But
Welcome.
it's a blessing for sure.
Yeah. Welcome to the club. And, it is what it is. I know I'm a little older than you, but I'm doing my best to keep as young as possible. In fact, it's guys like you that inspire me because I work out when I finish with this conversation. So So I thought about when I was being interviewed for Advocate Aurora. It's now Advocate Aurora, but it was Advocate at the time. Dr. Rick Bone was the medical director at the Beverly Clinic where I work on the South Side. And so one of the people that he introduced me to was Dr. Diana Grant, who's in another health system role now. But when I walked into that interview, it was different because she was an African American female. She may have had braids at the time. I think we talked about, eating greens and cornbread and stuff like that. Although I don't do cornbread as much anymore because I'm the low carb guy. But just seeing her in that role made me realize that this is possible. And it was her and the leadership Dr. Bone gave me as a mentor as well that actually gave me the confidence to become a medical director myself. So having people in your life who can inspire you and motivate you is really critical in order for you to achieve the goals that you have in life. So I'm not surprised to hear that you had that mentoring. So what I wanted to do as a post podcast live session is to walk through, maybe 3 or 4 slides, because I think this ideal of social determinants of health are helpful for people to understand, not just as clinicians and people in operations and leadership like yourself, but I'm talking about the average person. So they won't feel that blame game. I'm struggling, just like the example I gave. You have a reason to be struggling. You have a reason to not necessarily do as well. If I have to hear gunshots every night, that's going to affect my health. If I'm not able to go jogging in my neighborhood because I'm afraid of the safety, that's going to affect my health. So sometimes we have to be honest about these things. And even in this moment where we're talking about inequities, these are the types of things that if the average person understood it, they would not demonize and blame others and think that they are not interested in being safe and having, being healthy. No, that's not the story. Is you need to peel that onion and understand it. So what I want to do, Rashard, is let's walk through these slides and understand, what what you want to share with us today. And then hopefully the team, the people listening will get a chance to listen to the podcast as well. So let's talk about this first slide. Tell me what you want to share with this slide.
Yeah, this reason I chose these slides because they are very, very eye-opening, and I would say they set the basis and the tone for having discussions around social determinants of health. At Advocate Aurora Health, we are steadfast in our belief of transformation on the South Side of Chicago, and these are statistics that are just mind-boggling as you read them. So. These are things that I've come across in doing our due diligence and looking at our strategic plans and understanding how we tailor our healthcare services to our community. In Chicago, we have the largest life expectancy gap in the country. And there is African Americans on the South Side of Chicago. Our life expectancy gap is a 30-year gap. And when I heard that, I said, you got to be kidding me. Meaning, if you're on the South Side of Chicago, you're expected to live about 59, 60 years old. And if you're just 9 miles north, then you're expected to live over 90 years of age. So as we start talking about life expectancy, chronic diseases, you can look at the COVID situation that's plaguing the country and the world for that matter, but our community in particular. And these are, it just puts that microscope on this life expectancy gap that we're dealing with here in on the South Side of Chicago. So I thought that was just mind-boggling and interesting, and speaks directly to social determinants of health and some of the other areas that we touched on in the podcast.
Mind-boggling. Let me just say this. I did a tweet. Anybody want to follow Dr. Tony Hampton on Twitter, Dr. Tony Hampton, because I like to tweet things. And what I tweeted previously was an image of a gene, and it said, your genes are not your destiny. Your genes are not your destiny. So are your genes important? Absolutely. But it is your environment that has the biggest impact on your health. It's your environment. So the people you hang with, the food you eat, the lack of exercise, sleep and stress, all those things we talk about with that nest and rope, those have a bigger impact on your health than anything. And that's probably how we can explain this zip code discrepancy. I mean,
Correct.
we're in the same city,
Correct.
and 30 years different. I mean, I don't want to give away my age too much, but I'm not too far from 60. I'll be hitting 60 in about 8 years. And to imagine not being here after 60, not here for my family, not able to share knowledge like we're trying to do today with those young folk, I just couldn't imagine that. So this is an impactful slide, actually, that
Yeah.
telling.
Yeah. I mean, what you're looking at higher incidence of chronic diseases, as we discussed, diabetes, hypertension, COPD, CHF. You go down that entire gamut,
Okay.
and that entire spectrum that you're experiencing, and then and again the social factors of health, affordable housing, being able to get well-paying jobs, and where you can make a living wage is extremely important, and to everything that ties into the educational system that's there, the housing, affordable housing, as I mentioned, and some of the trauma that you also experience within a neighborhood. All of those are factors, critical factors, not to mention access to healthcare or a lack of investment, as far as having the right place, right time in order to receive your care. All of that affects that gap.
And I think all of us have to be responsible, whether it's me as an individual, you as an individual in our roles, our health system, and the people who receive care. We need to hear from you as we get better at collecting that data from you. You need to let us know. We can't be so embarrassed about the fact that we can't afford a medicine that we don't share that information. We need to let you know that we can help you, and you need to let us know where you need help. So I think that that's going to be a big part of this. It has to be a partnership, and it's also going to be part of what we do is, if we see you struggle with food, maybe you need to know we got a food pharmacy at Trinity Hospital where you can get some groceries and things like that. Of course, it's going to be healthy because that's how we do it. But there's a path to go from our current state to our future state. So tell me a little bit about what is meant by out migration, so our listeners can understand that.
So out migration just speaks to access to care or lack thereof, and as I like to really dive into it, I think it goes beyond that and talks about. I think there's a trust factor that's there. So on the south side of Chicago is interesting to see that 60% of the residents living within our neighborhood on the southeast side choose not to receive care locally. So they seek medical attention outside of our our demographic region that's there, and you can start going into the reasons why you believe that's a challenge. I think, quite frankly, I think it involves some of the aging infrastructure that we have. A number of our hospitals are all over 120 years old. That's there, so that's the need to have access that's in the right place at the right time. I think we need definitely investing in some of those preventative care measures collectively throughout the south side of Chicago, and that we are working on as a system. But it takes a partnership. It really takes state and federal help, as well as healthcare partners within the area. And I think it speaks to just whether or not we trust the care that's being provided, that's there, or do we have access to all of the services that's needed, with healthcare providers being within the area. So do I have to go for orthopedics and drive past somewhere else, or do I have all the primary care doctors that are there in the facility that I can go see, that I trust, that's easily accessible to me, or am I just running to the ED that's there? Do we get out into our community and let people know about preventative services and how important it is? Are we working with our local schools? So I think there's so much to unpack here as we look at this statistic, but it's important to know, because as healthcare providers, when we talk about social determinants of health, a big part of that is access to health. So, and if you're looking at access to health, do I trust the healthcare system the way that it's designed within my local community in order to receive care. And the overwhelming majority is telling us no, they have to drive past. So I think that's critical if we start talking about transformation and being able to turn that tide.
And it's very interesting. As you talked about that, I think about actually where myself and Dr. Rick Bone, who's our Vice President of Population Health for our medical group, and we both trained at West Suburban Hospital in Oak Park. And the irony of that is, I think we turned out okay, in terms of our ability to provide care. The family practice residency at West Suburban is one of the top family practice residencies in the country. Yeah, literally, I had people in my class from Yale and Harvard and places like that. And so the irony is that you have these very talented people in this small community hospital, but a lot of people in Oak Park didn't want to go to that hospital because it's like they just had these perceptions that it'll be better to go down to this brand name hospital.
Correct.
And it just, those perceptions are not always real. And the irony about all of this is that I remember when we had a ranking, and you know this better than anybody, but when they rank for quality of care in the country, AdvocateAurora ranks in literally next to Mayo Clinic and Cleveland Clinic and places like that. So it's like, but people don't know that because they're attached to these labels, and I understand it, but I think that we need to make sure we message that the quality of care is going to be really good. And more importantly, if we can figure out this social determinants of health piece, then we will be a value-added health system that you don't necessarily see. And I think all health systems have to figure this out, but we would definitely stand above the crowd if we were able to do that. So I'm going to go ahead and see what this next slide represents. Why don't you tell me a little bit about that one?
Yeah, and this dives deeper into, and all of this creates the culmination of the point that we're discussing around social determinants of health and the key factors and all the things that you need to take into consideration as you're delivering healthcare. So on the south side of Chicago, we see about 50% utilization of our hospital beds, and I think that's a derivative of that out migration that you're seeing. So just looking into the cost structure that goes there, looking into the trust aspect that's there, the primary reason why you have community hospitals is to ensure that you can deliver that quality care within your community and you don't have the need to drive outside. So you have that access that's there. So those are mind-boggling. And again, these aren't the South Suburban numbers that we're seeing that's there. But in particular, when we dive into Trinity's market area and we start looking at the social determinants of health that's affecting the south side of Chicago, I wanted to just point those factors out as you and I start having our conversation around social determinants of health.
Excellent. So I'll go to the last slide that you shared with me, and let's look at that slide and tell me what this slide represents.
Yeah. So oftentimes I'm asked that question around, okay, what do we do? Where are we going from here? What does this mean for us as a health system, and how do we get out in the community, and how do we tailor our resources to ensure we're able to meet the needs of those we're so privileged to serve? And so as an organization, a part of AdvocateAurora Health, we're proud of our Transformation 2025 initiative. And it takes a few waves, we believe, but it's fully integrated. And a couple of things I'll point out. If you look at the center and the core of our consumer first model, it's all about creating that destination health for the consumer and meeting the consumer where they are. So in particular, when you talk about social determinants of health, affordable housing, the lack of exercise that may be there, or a nutrition standpoint, ensuring that you have the proper food, things of that nature, ensuring that you have access to well-paying jobs, and we create that infrastructure for you. All of this is a part of our enduring mission to help people live well, which is our ultimate purpose, which is grounded in our values of excellence, compassion, and respect. So I wanted to show that to people to say so that the audience has an understanding that our strategy is simply grounded in creating whole person health. And that's where we are. And we envision us getting getting on that. We're on that journey now. We envision us getting to that platform, definitely a lot closer to that platform in 2025, and that's where our vision is carrying us moving forward.
Yeah, that's impressive. I think I remember when I first saw we help people live well on my on my computer screen, and that's what we look at that image every day and those words. And as a person that's into wellness, that meant a lot to me. And for me, it's not about diagnosing disease and treating it. It's more about how do I help my patients learn how to optimize their health. How
Mm-hmm.
do I help you live well, meaning that you don't even get sick? Or we take a diagnosis that you would have had at 60 or 70 and we stretch it out to 90. And if I'm holding my chest at 90, that's a completely different scenario than holding my chest at a younger age. And so I wanted to go ahead and remove that slideshow and get back to me and you, and just get back to just continuing our discussion. This will
Yeah.
be, yeah. So tell me some of your thoughts about like if you as you listen to this audience or have this audience who did not hear the podcast yet, when it comes to social determinants of health, just give me an idea as a president of a hospital. What's your vision of what that could look like in the future for a health system? What kind of things would you like to see in place? Maybe even start with the food pharmacy.
Yeah, no, I'm glad you asked that question, because as you think about it and you look at your strategy and you look at helping people live well, exactly what does that mean? Because helping people live well in one community may not be the same as helping people live well in the other community. But I think from a health system standpoint, it's all rooted in, I believe, getting outside of the four walls of your infrastructure and meeting the consumer where they are, whether that's going into our school systems, whether that's partnering with the faith leaders within our community, because there's trust that's there. And so we do that through Imani Village, and we partner with Trinity UCC, very robust partnership that we've established that's around whole person health and creating that concept of helping people live well. I think it epitomizes that. Or looking at your healthy food pharmacy. When we, as a health system, we go through our community health needs assessment, and we look at by zip code the things that are plaguing our community. And so it's not a surprise to the people that we deal with a food desert. And so how do you meet the patients where they are? Whereas with our healthy food pharmacy, and you're a leader in that aspect for us, being able to ensure that you have fresh produce, fresh vegetables.
Right.
Whereas, and not only that, but providing the recipes that's necessary to make it palatable, right? Because not all the time do we sit down and say, okay, this is great food, right? When you think about it. But I think those things I really truly believe that that's at the core of whole person health and addressing social determinants of health, one step at a time.
Yeah, I literally stopped by the house to pick up something on my way somewhere else this weekend, and my kids had prepared a curry chicken dish, some spinach. These are like college kids. What do they know about this?
Right.
Spinach and some mac and cheese cauliflower. And if my mama was in the area, I would have slapped her. It was so
Well,
good,
yeah. Well, you got me at curry chicken. My
It
wife's Caribbean, so
Oh, so you know all about
I
that.
know all about it. I know all about it.
Right. Well, real quick, I just wanted to do a shout out to Sean Hobson and George Muhammad. One of our Denise Taylor. Denise Smith is one of our nurses, by the way. She's doing a shout, and she has speaking of spiritual, she just got her master's in spiritual care. So now she's a nurse, and we may have to leverage her. She worked at Trinity Hospital in the
That's
past.
awesome.
So I may have to make sure you know who she is. You know what I mean?
Yeah,
And
please do.
Marine Catherine. So I just want to do a shout out to the people who were watching this live. I know a lot of people will watch this when it's not live, and I just wanted to get just a little nugget of what we talked about as we, do this Facebook Live, this YouTube Live, because I just think that a guy like Rashard is somebody you should know. And I want to make sure you understand that our health system understands these issues. I think this inequity challenge that we're faced is timely in terms of now it's going to force us. And what I think you would agree with, we need to see, like, you're an example of tangible change, right? You're in a role that, like, I remember, and I don't want to be, too stereotypical, but typically in the role that you're in, you'll see older person, and you probably see somebody that's not minority. So to see you in that role, to me, is an example of the type of change that we're going to have to kind of neutralize this inequity issue that we have. And I think that people need to see you, they need to get to know you. And I'm like you, man, we're going to put our tentacles in the community and try to let people know that change is possible. But everybody listening needs to understand, and it's a little, I don't know if you hear the train in the background, I'm close to the train, but everybody who's listening needs to know that it is up to each individual to do something.
Correct.
So the things that I did when the inequity discussion, I didn't walk around with a sign, but I did talk to the leaders in my organization
Yeah.
about what we can do together, work as a team. I shared some personal stories. They heard me, and I said, I don't want to walk alone. Are you willing to walk with me? And they said, we're walking with you. So that's what I want to. That's what I wanted to share. So I don't. So tell me any other messages you want to share before we kind of wrap up this session. Again, this was an opportunity to introduce the audience to the podcast. It'll be coming out on Friday, so I guess that's around the 17th or 18th. Make sure you get, if you, I know a lot of people are saying, what's a podcast, right? There's somebody in your family know what it is. So make sure you get that app on your phone so you can listen to what we hope to become weekly conversations on these different topics. So
Yeah. No, I think you brought up a pertinent point, which is when you're, and I'm a true believer, I'm a man of faith, and I'm a true believer that we're put in positions all according to God's purpose and where He placed us in life. And so when you're in that role, that position, it's important to share your story. It's important to share the context that's there for me. I hold no qualms about it. I let everybody know because I'm extremely proud to be a product of a single parent household and an inner city kid, and that's helped shape the way I look at social determinants of health, because I've seen sort of the challenges that it's had on not only my life, but then that of my family, or continue to have on that of my family, right? And so as a health system, as we get in and we do this critical work within our community, it's important to understand the roots that's there. It's important to understand that, not everyone has the same educational structure within their community. Not everyone has the access to, grocery stores that provide a great nutrition for you. You may have fast food. There was fast food on every corner where I grew up. Not everyone is able to go and exercise. I think you mentioned, you start talking about that. If there's violence around you, you go out and jog? I didn't start. I mean, I played football, but I didn't really jog a neighborhood until I got to college. And think about that for a second. So I just think it's important, as we start shaping, meeting people where they are and getting into the community, we take all of those factors into perspective, because ultimately, at the end of the day, that's what healthcare is all about, and that's where healthcare is shifting. And so to be on that journey within our health system and to do it along with you, I'm excited.
Yeah, I think we're tied by the hip, so just let the wife know you got a buddy that you're gonna be hanging with.
Yeah.
Our
I think,
are lined up perfectly.
yeah.
And I look forward to that. I want you to learn some of the stuff I have in my head, and in fact, I'm in school. I may have mentioned that before, so I got to go and study. So I'm going to exercise. I'm going to hit the book so I can learn about this nutrition, which we don't learn in medical school, and I'm excited about that. And I just wanted to, again, just introduce you to this audience so they know about you. They're going to get a chance to meet you some more, and we're going to be doing more work, and we'll probably have another opportunity like this. So with that, any closing remarks before I wrap it up for us?
No, just want to say thank you for having me and giving me this opportunity, and for having this platform, because it's a pertinent discussion, and it's one I think it's a series of discussions that we truly need to have as we're on this journey. So this is a marathon, and this is not a sprint. And it takes all of us. It takes building trust. It takes being able to be vulnerable and have open, transparent conversations around what we need to do for our community, and ensure that we're addressing those social determinants of health so that we can help people live well. That's our mission. So I'm excited to be on this journey.
Well, thank you for being here. And for everybody listening, it is so important that you partner with us, because we can't really resolve any issues or even attempt to if we don't know what those issues are. So just make sure, be comfortable sharing your struggles. We're going to continue as a health system, as individuals, to do a better job. And I promise you, if you do that, you're going to be fine. So again, this is just a small example of, and social determinants of health kind of speaks to a lot of this nest and rope concept, but we need to understand struggles so we can then heal from chronic illness. So with that, I appreciate you guys who were listening in, and make sure you share this video with anybody you feel needs to understand social determinants of health. Make sure you get that podcast going with Protecting Your Nest. And until next week, we will sign off. So you have a great night. Get home to your wife and your kids, all right?
Oh, yeah, those 4 kids are waiting, that's for sure.
So they're going to be right at the door. So you do your thing, and I'll do the same, okay?
All right, have a good one.
Have a good one.
Thanks, Doc.
All right, bye-bye.